The problem with Medicare for all is that when people say that it's affordable, this isn't affordable to the person who has the Medicare. It is not affordable to the country. In fact, it is so unaffordable to the country that the state of California was a nut job leftist state, just refused to even pass Medicare for all because it would have immediately doubled the debt. As far as the idea that Medicare, that medical care is a right, but it's not actually a good or a service, this is a way to make things less plentiful. If you declare things right, but you don't actually incentivize the creation of those things, you don't get more of them. So the South African Constitution has right in there that healthcare is a right, that housing is a right. The fact is that you don't have good housing or healthcare in South Africa because just declaring things rights does not make them appear. What makes more things appear is a market-based system that creates more doctors, that creates more medical care, that creates more incentive for people to join up. This is why I say that it is better to treat things as goods than as rights, because declaring something a right just means that you have the right to steal it from me. But declaring something a good means that you get a market process that leads to lower prices and better care over time. And the big problem we've had before Obamacare is that it was already treated quasi as a right. You had it heavily regulated on the state level. It is continually heavily regulated. The idea there's a completely unregulated market is absolute nonsense. The reason that you have employer-based health insurance in the first place was as a response to wage and price controls placed in the aftermath of World War II, and employers began giving health insurance as an actual good, right? They gave it as an actual incentive to their employees. If you had an actual individual-based health insurance market, you bought it just like you bought your car insurance, you would see more and better health care for everyone.